Chapter 9, Health and Disability Income Insurance. And here are the learning objectives for this chapter. So what is health insurance? So it eases the financial burden people may experience as a result of illness or injury. You pay a premium to the insurer, and it includes medical expense insurance, which pays only actual medical costs, and then disability income insurance. That provides payments to make up for some of the income of a person who can't work because of an injury or disability. Most people who have health insurance are covered under group plans sponsored by employers. Individual plans can be adapted to meet your own needs. You should comparison shop because rates vary. Not everyone qualifies for COBRA, and it can be very expensive. There are several types of health insurance coverage. First, there's basic health insurance coverage. Then there's hospital expense, surgical expense, physician expense insurance. Most popular plans are either major medical or comprehensive major medical insurance. Next, we have hospital indemnity policies like AFWAC. Then, of course, there's dental insurance. Then vision insurance, then psychology or dread disease policies, or long-term care insurance. Now the psychology of dread disease policies are now illegal, and they used to take advantage of HIV/AIDS patients or cancer patients. And then, of course, long-term care helps cover nursing home expenses. So who is eligible and who gets paid and how much is paid? These are some good questions to ask when you have health insurance. And are there upfront costs associated? And then what are the benefits? And are there benefit limits? So all of your insurance have all of these provisions spelled out for you when you sign up for insurance. Also, are there limitations, and what happens next year? And then how can the policy be canceled? You'll want to know all of these things about your insurance, and it's different for every policy. So different policies may offer different benefits. As you decide which insurance plan to buy, consider these trade-offs. And here are some health insurance must-haves. Pay close attention to this list here. Most health insurance in the U.S. is provided by private companies rather than the government, like Blue Cross Blue Shield would be a private company. Focus on preventative care, but also, a private health care plan, focus on preventative care, but also cover surgery, insurance, and diagnostic tests. That would be a health maintenance organization, an HMO. PPOs are like HMOs, but offer greater flexibility. And then point of service combines HMOs and PPOs. Then there are also home health agencies and employer self-funded health plans. The next three are some new innovative ways employers are providing health coverage to employees. There's health spending accounts, health reimbursement accounts, and then flexible spending accounts. And here's a table comparing these three types of accounts. Government health care programs cover about 50 million Americans. Medicare covers people 65 or older and or the disabled. We pay into the Medicare system through our payroll taxes. There are 4 parts to Medicare. Part A covers hospital expenses. Part B covers medical expenses. Part C covers, fills in the gap there from what is covered and what is not covered with Part A and Part B. And then Part D covers prescription drugs. So each part covers something different, and there's lots of deductibles and copays. And there are costs, and then there are many costs that are not covered. Medicare Choice and Medigap is additional purchase coverage. And then there's Medicaid, and it's provided by the state, but funded by both state and federal funds. And here's a table comparing various Medicare plans. So health insurance and payment protection and the Affordable Care Act of 2010, also called Obamacare. I'm going to read all of this to you. It's very important. There was $635 billion set aside over the next 10 years. A few of the key plan provisions. There's tax credits to small businesses to offer coverage, prohibits denying coverage to children with pre-existing conditions, temporary high-risk pool for uninsurable, eliminates copays for preventative care, allows young people to remain on parents' coverage to 26th birthday, prohibits lifetime caps on coverage, and requires most to purchase insurance. The individual shared responsibility provision requires the individuals either have minimum essential coverage or have an exemption or make a shared responsibility payment with their taxes. You can go to healthcare.gov for options of minimum essential coverage. Or there's an exemption, subsidized coverage, making a payment, health insurance marketplace. The American Health Care Act of 2017, this is actually irrelevant because it was withdrawn and never moved forward. The Department of Health and Human Services operates websites with lots of health information. And then disability income replaces lost income due to disability. Before purchasing disability insurance, take a full evaluation of what's already available to you. A lot of employers provide this to you as a benefit. You must make certain trade-offs when you decide among different private policies. Here's a worksheet you can use when deciding on coverage. And then check out this section describing why healthcare costs are so high. The high and rising costs of healthcare are attributed to many factors, and I'm going to read through these. So sophisticated technologies, duplicate tests. I'm sure you've probably been to a doctor at one point who referred you to another doctor who ordered the same test the first doctor did. However, when all of that's not explained to you in great detail, you really aren't sure. You're just running to the lab to get tests drawn, and you don't realize that that's what the other doctor did previously. Variety and frequency of testing, increasing number and longevity of elderly, regulations, increase in emergency treatments, limited competition, rapid earnings growth for healthcare professionals, using more unnecessary medical care, built-in inflation in the healthcare system, aging baby boomers, and then other major factors such as fraud, waste, and malpractice. All of those things contribute to the high cost of healthcare. And then here's a graph detailing how how costs are dramatically increasing. So in 1970, we were way down here. Now we're way up here. Or actually, we're in 2020 right here. What is being done about the high cost of healthcare? Carefully review healthcare fees, incentives to encourage preventative care, community health planning, prepaid group practices, community health education programs, and then paying cash. And what can you do to reduce personal health care costs? You can consider a flexible spending account if offered. I have that where I have them take out a certain amount of my check out before taxes. And then I have this lump sum available to pay those costs as they come up. I can use for my copays and deductibles. Consider a high deductible health plan. Ask for generic medicines. Consider using a mail order or legitimate online pharmacy. Most states offer free or reduced insurance for children under 19. I know Michigan does. It's called My Child Insurance. Pharmacy assistance programs. Ask if follow-up visits are really necessary. Think about non-urgent procedures. Review statements for billing errors. Appeal unfair decisions from medical providers, and then practice preventative care and stay well. The best way to avoid the high cost of illness is to stay well. Right now, more than anything, eat a balanced diet, keep weight under control, avoid smoking, don't drink excessively, get rest, relaxation, and exercise, drive carefully, protect yourself from medical ID theft. And that is it for this chapter.